You and I have had lots of conversations about recovery and how when people ask you what is recovery or you're in recovery, what does that mean? And again, one of the hardest places I think sometimes is when you're in a physician's office or getting health care and trying to explain why you're to your physician that you're in recovery and that it's a positive thing, not a negative. And so when someone asks you about being in recovery, what does that mean for you?
So for me, it's that for today, I choose not to drink or drug, frankly. It's been based on a long history of trying to be a controlled drinker and not being successful at that. So I, early on in my recovery, when I made the choice, I didn't overcomplicate it. It was just, it wasn't, drinking wasn't working for me any longer. And I didn't like the person I was. And I had been exposed to recovery in my family, and I wasn't taking the same path, but I knew I wanted to get to the same place. And so for me, recovery is making the daily choice to live a clean and sober life.
Yeah, and so and sometimes when we, it's I know that when my dad was first in the program, and someone would say to him, he'd tell people I'm an alcoholic, and it was always sort of this. People would look at him like, oh, he's an alcoholic, and then he'd say, well, I'm not drinking, and he was always searching for this word. And what's a positive word without? He knew he was an alcoholic. He wasn't ashamed of it, but it had such a stigma to it. So I think if he was alive today, how much he would love that word, recovery, because it meant, yes, I am an alcoholic, but no, today I'm choosing recovery. Today I'm in recovery, and I'm choosing not to use alcohol and drugs, and I'm moving forward. And so if we're in a physician's office and being able to say to them, it's not a negative, it's a positive. I'm in
Yeah.
recovery.
Yeah. And I know a lot of people that use the word I'm recovered, and I am never prepared to say that. That's good for them. And if it works, that's fine. But for me, that's too permanent. I've got today, and it makes it easier for me. Do I ever think I'm going to drink again? I don't believe I will, but I don't need to worry about that. I don't need to make it more complicated. I'm pretty certain that for today, I won't drink, and for the foreseeable future. So I choose recovery as an ongoing process. The other thing that I've used in the past is that I ended up developing a severe allergy to alcohol. When I ingested it, I had a reaction, and it wasn't the reaction that I was looking for. And some people get that. So when I go to the doctor, and I have a new physician, I I say I'm in recovery, and they ask me sometimes from what, and I will tell them, and but then I'll say, but really, it's not just the substance; it's my personality. It's some of the things in me. And I have to be really, really careful. And I'm sharing that with them as a way to be a partner in my own treatment for whatever I'm there for. So I really do keep it simple. And I've learned over time that if people have a reaction, a negative reaction, that's kind of on them. And I've just got to figure out if they accept my my health history in a way that I think is going to lead me to have a positive relationship with that provider. And if I don't, then I think I need to find somebody else.
So, what we've had experiences before where physicians have prescribed to you medications, and that when you saw those medications, they sort of triggered in you, or sort of said to you, "Whoa, wait a minute, I don't know." How do you get your point across? What would you give advice to people in recovery whose a physician may be prescribing a medication that may be difficult for them to take, but yet important for them to take because it is about a recovery from another illness?
Yeah, I have that conversation with them. It's like, okay, how long are you recommending? And I volunteer what my safety plan is. Like if it's pain medicine, um, it's it's sort of really almost prescribed to my wife. She's the one that gets it. She's the one that I'm there, but there's an understanding among the three of us around how that's going to be, because early on I would get kind of nervous about it, and I wouldn't talk about it. And then I'd say, well, I don't need to take it right now. I'm going to wait. I'm going to wait, thinking I was doing something that was healthy and in my interest. And what I learned was, when I really needed it, if I didn't take it when it was prescribed, then the pain would get worse, and I'd end up taking more just to get on top of the pain again. And so by taking it as prescribed, then it seemed I managed it better. It did what it was supposed to do. And so I had a few surgeries early in recovery, and when I figured that out, my wife got the prescription, and she would literally set an alarm and wake up, and the 4 hour or the 6 hour or whatever the interval was, and say it's time. And I'd say, no, I don't think I need to take it. And she'd say, no, just take it. And so I didn't have to do this mental gymnastics and do a judgment about myself in a very vulnerable time. And what I learned from that, and it happened a couple times, what I learned was I knew when it was no longer doing what it was prescribed to do. And as soon as I started to look forward to getting it, or I had a different reaction to the medication, that was when I needed to stop. And I just said, no, I don't need any more of that. And I took aspirin or ibuprofen or whatever was the step down. But it was like, and I can remember those like moments of clarity where it was like, oh, okay, something's turned in my head, and now it's doing something different. And I'm just, to thine own self be true, right? I'm going to be honest, and that's worked for me.
And I think that works. That's a hard part about recovery, and about sometimes worrying about what people will think when you take medications. That they'll think I'm not in recovery anymore, or you'll think poorly of me if I ask for medication or I don't. And I think the way your wife and you have worked a safety plan around prescribed medications that you need for your physical health is wonderful. And I think more physicians need to know that family members are important in these decisions, and how to do that, because that support person knows you, and they know when when to have it. They know you need it, but they want to be supportive, and they also are a little scared because they don't want you to relapse or not be in recovery, because recovery for them is as important to them as it is to you. They love you and they want your recovery. And so when physicians understand that that sometimes people in recovery, even people in what they refer to long-term recovery, sometimes need a support system, that safety plan that says, this is what I'm going to do.
Well, it's interesting because during COVID, most hospitals and doctors' offices don't allow anybody to come in with you.
Correct.
And yet, I've thought about this. If I were physically challenged, there would be reasonable accommodations to make sure I could get access to my health care. But I was not allowed to bring anyone with me last summer. And so I had the conversation with my surgeon, who I didn't know very well, and I had the conversation about being in recovery and being concerned about being prescribed what I was going to need post-operative. And I was alone. And I've thought about that. If I had some other kind of health condition that I needed, or if I was a child, or if I was really old and needed someone to help me navigate that conversation for other reasons, it would be allowed. But I don't think I would have got through the door of the hospital if I stood on that ground saying, no, I'm in recovery. I need someone with me because I need that support. And so I wonder, how many people were more vulnerable because there wasn't a recognition of the issue of addiction in that interaction with the physician. So,
and again, it takes a lot of self-confidence to be able to say to a physician, because there's stigma there, I'm in recovery and I need support. And there is that fear that goes on in your head that says, if I ask for support, they're going to think I'm weak and I'm not in good recovery. And that's not what that is. It's totally different than that. And you're right. I think again, it's one of those things that maybe someday we really truly will believe that substance use disorder is an illness that is treated like your arthritis, your diabetes, and that sometimes you need support if you're older or a child and you need interpretation. You know, that stigma piece. But as long as we continue to try to normalize it, that it's an illness, it is with us and it's there and it needs support. And asking for support doesn't mean you're not in good recovery.
Well, yeah, and I wonder if I didn't have the address that I have or the occupation and the reputation I have, number one, would I be comfortable saying those things because I would be judged? Or just what I'm saying is more accepted. I mean, I still have, thankfully, my mom around at 89, and 33 years later, if I say to her, well, gee, I'm doing an interview, she'll always say, oh, Sean, why do you have to do that? That's not you now. That was a long time ago. And I get reminded that stigma is alive and well. Yeah. And she's very proud of me, but she'd be much prouder, honestly, if I wouldn't continue to share that part of who I am with the world. And it's a good reminder for me because, again, I've got a lot of things going for me. And I think of people in early recovery or who have other challenges in life that complicate this. You know, maybe it's their job's on the line or something like that. My last 3 employers knew before I came to work for them that I'm in recovery. And I've been able to use that, I think, in a positive way, because I really believe that I can help put a different face on what people think of when they think of addiction and recovery. I hope anyways. And that's, I'm fortunate to be in the spot I am. And that's why I feel compelled to do this.
And it's, you know, I was in a conversation the other day that they're thinking about taking away some of the regulations and confidentiality in regards to substance use disorders because they want it integrated in with your regular health record. So in my head, I say to myself, well, that makes sense. It absolutely should be there. But then the other part of me says, are we ready as a culture to not stigmatize somebody because it says this person, you know, has a substance use disorder? So it's sort of a tricky thing. I get it should be integrated in with your health record, but who looks at that health record and who determines whether I may not be capable of a job or capable of parenting or all those things that shouldn't be there? So it's this piece of recovery and where we are in our culture, I think, is a good place. But there's also a lot of places that I get a little leery and think, whoa, you want to protect people from.
Well, I just had that conversation with my provider because now with medical records, when I go to see her, I get a report the next day or that day, and I can go in and look. So I went in and looked, and right at the beginning, there's a big flashing sign that I have an anaphylactic reaction to penicillin, and it's there. And there's nothing about alcohol. And so I kept scrolling through my record, and if it said anything, it says no report of alcohol use or in the last, whatever it is, 30 days or 90 days. And so I challenged her about that. I said, you know, that really doesn't say. She goes, oh, it's here for me. You just can't see it. It's behind the wall. And so she showed me. Not like I needed to be reassured, but it really was interesting that my allergy to penicillin was there for the world to see, and my allergy to alcohol was not there for anyone unless you had the secret password or something. So again, it's a reminder, right?
It is.
We live in a world that, you know, we don't treat issues of the head and of the spirit in the same way we do as the body.
Yeah.
And I think that's a shortcoming that we've got to figure out a way to get beyond.
Yeah, they do. I think people will become much more comfortable when we realize the head is attached to the body. I truly believe that.